Thank you, Francis. Good morning, everybody. I'll have myself on camera for most of the presentation, but I might take myself on and off just to navigate some slides. But again, thank you for joining us today. So I am the broker relationship manager here with Quartz. I specifically focus on our ACA and individual line of business. But if you happen to be in the Medicare space, I also back up our Medicare broker relationship manager, Stacy Adler. I am also a licensed insurance agent. I have been for over 20 years, kind of ages me a little bit, but just so you know, the reason I share that is because I'm aware of all the training requirements you guys have to do. I do the same ones, as well as I appreciate your time and know how valuable it is with all the products that you sell and companies that you represent. So my goal this morning is for you to definitely take away things to make this a useful part of your morning. And I'm going to go through quickly on some of these slides because I also want to be able to share the platform on how to enroll somebody directly with Quartz if somebody is looking at an ICHRA. But before that, I just want to give you a little bit of background about us and tell you a little bit more about how we work and more about Quartz. So I'm going to go ahead and get started. And again, this slide presentation, I will go through pretty quickly, so I'll be able to share some time or have some time for questions and answers, as well as the enrollment platform. So again, thank you for joining. Welcome. So my agenda, I'm going to go through this real quickly, but just telling you about our story. Why Quartz? What makes this different when you're looking at the individual space? We'll talk about some highlight things, benefit extras. And again, I'm going to breeze through and actually skip some of these slides because this is the big training that I do for open enrollment and when people are getting new to Quartz, but I know we need some time for the enrollment platform as well. So I'm not going to go through the milestones in detail, but something that I want you to make sure to take away from this slide is that we are a private company. So when you're looking at the top left-hand corner, you're looking at this farmer. So we started in 1983. We were one of the first rural-based HMOs in Wisconsin. We were known as HMO of Wisconsin, actually one of the most first rural-based HMOs in the nation. So we are a privately held, provider-owned health insurance company based in Madison, Wisconsin. We've been around for over 40 years. Over these milestones, we've had some name changes and some mergers. So when you're looking at the middle of the slide, the biggest year of change we had was 2017. We merged a couple legacy other provider-owned health insurance companies together. We merged Unity Health Insurance, which is based in Madison and Sauk City, Gunderson Health Systems, which is based in La Crosse, Wisconsin, and then also Physicians Plus. We merged those three legacy companies to become one and rebrand as Quartz. But again, the takeaway is to still know that we are provider-owned and private. We have been in the individual space since before the Affordable Care Act. We know what we're doing, and we've got it down pretty well. So as you're continuing to look through the milestones, another owner of ours is Advocate Aurora joined our family. So our main health system owner is UW Health, which is the #1 hospital system in Wisconsin, #1 hospital in the state of Wisconsin. Gunderson Health Plans up in the La Crosse area, Unity Point Health Meriter, and then Advocate Aurora, which is more into our Milwaukee footprint. So again, provider owned. What that means to you being an agent working with a client that's looking at us is our prior authorizations, for example. You hear a lot about this in the news. We do not turn down prior auths if this is a covered benefit and our doctors are asking for it. We approve things quickly. We are there when your clients need us. That's the most important thing about health insurance, right? Obviously, it's there to protect the client, but it also needs to work when they need it to work. Another thing to note is being private, we don't outsource anything. We have a couple programs that we contract with other vendors and participants to work through, but we don't outsource our customer service or our claims. So when you're a client or when you call into customer service with us or contacting our broker team, you are talking to a Quartz employee. We also pay a good living wage to our customer service reps. We truly want to exceed your client's expectations. They are not going to be calling another part of the country. They're not going to be calling another part of the world to get help. So just wanting to make sure that it's going to feel a little different. Nothing against the nationals, but being a smaller provider-owned company does make a difference when it comes to the service and how we handle things when you need us. This is our footprint. The reason that I called this Wisconsin training is because the majority of our footprint is in Wisconsin. but we do service 7 counties in Northern Illinois and 5 counties in Minnesota. So when you're looking at the map, and I apologize, I know it's a little bit of a fuzzy map, but your client just needs to live in one of the turquoise colored counties in order to purchase a plan. And obviously I'll go through and show you how to quote that, etc. But that is our biggest footprint. Okay, so I'm not going to go into details about the networks, but the networks are going to be in the plan name when you guys quote. So you're always going to know what the network is when you're looking for a provider. Obviously, where your member doctors is a very, very important piece of the decision-making process of insurance, right? So checking network is going to be important. I always tell everybody the place of truth is going to be our website. And if something doesn't seem right, for example, if you're looking at a UW doctor and it doesn't come up for you, that would not be normal, right? Because they're our main owner. So we want to make sure that you feel comfortable reaching out if you have any questions about that. But again, we have different network names based on where that member is located, but it's always going to be in the product name when you quote. So our biggest one is called Quartz Achieve. We also have a narrow network in the Gunderson performance area that is affecting just those 3 counties. We're the most competitive carrier in those 3 counties, but it does give them not a narrow network where they can't see our big providers, but excludes a couple smaller regional providers. So again, it's like our big network, but just excludes some of these. And I can also, Francis, send this slide presentation over to you guys when we're done too, so they can go into the deck a little bit deeper. Again, we're provider owned by the health systems on the left, but we also contract with a lot of other regional providers. This is very important to be able to give access to care. So obviously our owner providers are going to all be in network, but then this is just a small sampling of some of our other regional providers. This is by no means comprehensive. Again, a lot of doctors